Welcome to our virtual event on the nation's mental health crisis. I'm Tina Reed, Axios healthcare editor, and I'm coming to you today from Arlington, Virginia. Welcome to our audiences on Facebook, YouTube, Twitter, LinkedIn, and on Axios.com. You can join the conversation today on Twitter with @Axios and #Axios events. Over the next 30 minutes, I will be joined by my colleague, Caitlin Owens, and we'll discuss the state of mental health in America and what national and local initiatives are helping to turn the tide. Our first guest is the Assistant Secretary for Mental Health and Substance Use at HHS and the Administrator of Substance Abuse and Mental Health Services Administration, Dr. Miriam Delphin-Rittman, joining us from Bethesda, Maryland. Hi, Dr. Delphin-Rittman. How are you doing today?
Hi, Tina. I'm doing pretty good. Thank you so much for having me on.
Well, thank you for being here. I think so many of us can relate to the increasing mental health struggles posed by COVID. It's definitely much more of a conversation, I think, in America right now. But can you talk a little bit about, what the state of mental health is in America and what we're kind of facing right now?
Yeah, so we certainly have seen when we look at data that the pandemic has had an impact in terms of mental health. When we look at data, we see increased rates of anxiety, depression among young people. We also see increased overdose rates among adults. And so, some of our thinking is that the pandemic has had an impact on the well-being of the nation. And we're seeing that bear itself out in terms of some of the mental health and substance use related trends that we're seeing across the lifespan. And so we're really focused on working to address the behavioral health needs of the nation at SAMHSA.
Do you also see a changing conversation? I feel like, for instance, more athletes, more celebrities are talking about their own struggles. How are we kind of seeing the conversation about this changing?
So we are seeing more conversations around mental health, and you're right. We're seeing athletes talk more about some of their mental health challenges. I think that helps to reduce stigma, and it helps to make conversations around mental health more normalized, if you will, and more a part of just everyday conversation. So I applaud the athletes that have come out and shared about their mental health challenges. I think, again, it helps to reduce the stigma and helps to give people hope that if they're struggling, it's okay to reach out and get help for what they're experiencing.
So 988 came out earlier this summer. I'd like you to start by talking a little bit about, first of all, what is it and why was it created?
So 988 is a 3-digit number that a person can either call or text or chat to 988lifeline.org. And they can get help with whatever either mental health or substance use or suicide-related crisis that they may be experiencing. And so it was developed to help increase access. To help increase access to crisis services and supports, and ultimately to help people get connected to any services and supports that they may need. It's an easy to remember number. And so, already what we're seeing is that people are reaching out, and we're seeing increased both call, text, and chat volume.
Can you dig a little deeper on that? How much have you seen the volume increase?
So, when we compare this past August to a year ago August, we actually see a 45% increase in calls, texts, and chats. So that lets us know, people are reaching out. 45% increase. It has amounted to 150,000, over 150,000 additional calls, texts, and chats that have come in. So that's a significant increase, and we appreciate that people are reaching out and getting the support that they need for their mental health or substance use related challenges.
Now, there's a lot of infrastructure that goes into making this actually happen, and there were a lot of concerns in the lead up that, some states were better funding this than others. How has this been working so far? Particularly, how has it been working in states that maybe haven't funded this quite as well?
What we're finding is that the states are absolutely stepping up. The funding has helped. So the administration has invested $432 million. About 105 million of that went directly to states to be able to shore up their call centers. Also supported the Lifeline infrastructure with resources there. And have developed backup centers to help ensure that any calls that the states aren't able to take on, that the backup centers are able to answer. So what we're finding is that the states are experiencing significantly increased volume. And though they're all in different places, by and large, they're keeping it up, as much as they're able to with the increased volume while they're also staffing up. And then, of course, our backup centers are able to pick up any extra while, of course, they're still building their teams at the crisis call centers.
And just keeping along those lines, I know that there's been some myths out there about whether or not the police would actually get sent out if somebody in a mental health crisis was calling 988. There are also concerns about people being stuck waiting on hold. Could you address some of those concerns specifically too?
Absolutely. So, so one thing that we do want people to know is that when they call 988 or text or chat, by and large, what we find is that people's challenges are able to be addressed right there on the line. And more often than not, mobile crisis teams are not needed in terms of a call, and the police are not needed in terms of a call. We also want people to know that it is anonymous. So when they call, they don't have to let folks know where they are or what their name is. And so it is an anonymous call, unless, of course, there's an emergency. If there's an emergency and they're needing additional assistance, we will sometimes ask, where are you? So that we can, deploy mobile crisis if that's the case, or 911 if that's the case as well. But by and large, when individuals call, what we find is that the distress that they're experiencing, again, whether it's mental health related or substance use related, is able to be addressed and managed right there on the call. And so that certainly has been a help. I think the other thing I do want to let people know is that with the increased staffing and the additional resources that the Biden-Harris administration has dedicated to 988, what we're finding is that the call time, answer time, has decreased from, it used to be 2 minutes, 30 seconds. So last August, over a year ago, or a little over a year ago now, it was 2 minutes, 30 seconds. And now the call time is 42 seconds. So by and large, people will not be waiting a long time on the call or on the line for someone to answer. Although, again, certainly we do recognize if someone is in crisis, 42 seconds may feel like a lot. And we want people to hang on, because there will be, a trained crisis counselor who is compassionate and who is ready to hear and work with them around what they're experiencing. And again, 42 seconds is the average answer time for those calls, texts or chats.
Right. Well, I want to go back to something you said at the top of the call. You were talking about the concerns about substance use, and that's also been obviously a major concerning trend in the U.S. Could you talk about what we're seeing right now?
So what we're seeing is that, the substance use and overdose rates, when we look at the data from last year, we are continuing to see an increase. About 107,000 Americans, passed from an overdose last year. Those are heartbreaking trends. I mean, definitely lets us know that there is more work that we have to do there. So we are seeing, unfortunately, increases there. And fentanyl, what we see a lot is that illicitly manufactured fentanyl is often a part of those overdoses. So individuals often may not even know that there's fentanyl in the substances they're using. And fentanyl is highly potent, highly addictive, and even a small amount can contribute to overdose.
What are some of the groups that are being most greatly impacted by this?
When we look at the overdose data, what we find is that all communities, all age groups are impacted. Unfortunately, it is across the board. When we drill down a little bit further, we do see increases in terms of African American individuals. So we see some spikes there in terms of increased overdose rates. We also see high overdose rates within Native American communities as well. And so recently, or soon actually, we'll be releasing our tribal opioid response grants and our state opioid response grants. And each of those grants are geared towards funding a broad range of prevention, treatment, recovery, and harm reduction services and supports at the community level within both our states and tribal communities.
Well, I'd like to be able to leave our audience on a high note. Are there any examples of any programs that are coming that we should be watching for, or anything that's been shown to work so far?
Yeah, so as a function of the Bipartisan Safer Communities Act, SAMHSA was appropriated a range of resources. So, for example, $120 million in grant funds for mental health awareness training. We know mental health awareness training is so important in terms of being able to raise awareness and help individuals who participate in those training programs, whether they be first responders or within school settings or community settings, and to be able to recognize when an individual is having a mental health crisis. So mental health awareness training grants and resources, we were allocated, and so we'll be disseminating in terms of grant programs. We also, an additional $25 million in suicide prevention related resources. So we absolutely appreciate those resources from the Bipartisan Safer Community Act as well. And so those are just two grant programs. One more I'll mention, we have about $40 million in terms of youth mental health grants that will be disseminated as well through those, through the Bipartisan Safer Community Act resources. So a range of grants that we'll soon be putting out notice of funding opportunities for.
Well, terrific. Well, thank you so much for taking the time today.
Oh, you're welcome. Thank you so much for having me on.
And next we have a View from the Top segment with Chris Freites.
Good afternoon. I'm Chris Freites here with your View from the Top segment. And I want to start by thanking our sponsor, CVS Health, for making this conversation possible. And joining us now from Boston, Massachusetts is the president of CVS Health's Behavioral Health and Mental Wellbeing, Cara McNulty. Cara, welcome to Axios.
Thank you for having me, Chris. It's great to be here.
And I am very excited to have this important and what's frankly a pretty timely conversation. I mean, just this week, a group of medical experts recommended for the first time that all adults under the age of 65 be screened for anxiety, which I think is pretty telling about where we are as a country. But I wonder, what is the state of mental health in America today?
It's totally telling, Chris. I mean, if we think about just the last 2 years, the pandemic has had a massive impact on the mental health well-being of our country. And actually, we know that 6 in 10 Americans feel that their mental health has been impacted over the last 2 years. And if you think about that 6 in 10, that means everyone in your ecosystem, whether it's you or your spouse or your kids, somebody has been impacted. And we know that one of the silver linings of this impact is that 6 in 10 has caused us to, as a country, to talk about mental health, to talk about mental health differently, and to talk about our mental well-being.
And I think that is a huge number when you say 6 in 10. I mean, that's 60% of us, right? And when you look at who's been impacted, that has fallen disproportionately, it seems, on young people. They seem to be in dire need of mental health support. And I wonder, why has that age group been hit so hard?
Yeah, it's really important for us to think, most of us haven't ever been through a pandemic, but we've been able to experience something like it, maybe an economic downturn or a disruption. But our adolescents and young adults haven't had that North Star or anything to compare it to. And then think about their lives over the pandemic. How they went to school changed, where they went to school, their events, the things that are most important, whether it's playing in a sport or being an athlete or being involved in an academic club, all of those things changed. And if it were just one piece of their ecosystem that changed, that would be easier to resolve. But what we see they've experienced is micro losses. They didn't go to prom, they didn't graduate, they didn't get to participate, They didn't get to socialize in the way they are used to. And those micro losses have had a profound impact. It's like dropping a rock into the water, the ripples. And so what we see is young adults and adolescents are really suffering and experiencing more mental unrest.
No, that makes a lot of sense. I mean, they've just lost so much over these last few years, as you point out, real big milestones, proms, graduations. So I wonder, what can we as adults do for the young people in our lives to help support them?
Absolutely. One of the best things we can do is talk to young adults and adolescents about their mental health well-being and help to normalize it. We did a recent survey that looked at teachers and parents, and what we found is 76% of teachers feel that adolescents are suffering, their mental health is suffering, where in contrast, about 50% of parents felt their adolescents and young adults were experiencing some mental health disruption. But then on the other side, what we see is young adults and adolescents are going to their teachers and they're talking to their teachers about their mental health and how it's impacting them. And when you think about that, it's really important we have a place and space for our adults, our young adults and our adolescents to seek help, whether it's their teachers or their parents or their community members. We need these young kids to know that they're not alone. And so the silver lining in the pandemic is we've created space for these young adults to ask for help and to say, hey, I'm not okay, and I just need some support.
Normalizing it, which so much better than what we had when I was a kid. I think that's a huge advancement. In fact, I think a lot of us are maybe stuck in kind of mental health treatment. We have that picture in our mind of the therapist on the couch in a private office, but that's not the only way to get treatment these days, right? How has mental health evolved?
Absolutely. That's not what mental health and mental health support looks like. We use at CVS telemedicine, and we've seen that telemedicine utilization go to about 60% of those we serve are being seen via telemedicine and televideo, making it really easy for these young adults to get care and support where they're at when they need it. We also use things like text and chat therapy, and also offer in-person, face-to-face support. So the key is to provide different modes and modalities for our adolescents and young adults to seek the support and care they need when they need it. The other important part is to treat our mental health well-being just like our physical health well-being. Think about our physical health. We talk about getting exercise and eating well and getting sleep. We need that same nutrients for our mental health, and our mental health and our physical health aren't separated. So getting rest, maybe taking a break from social media, allowing our brains to step back and understanding that what we're experiencing today or what they're experiencing with their mental health and mental unrest doesn't have to go unseen, and there is help.
Yeah, such a much more holistic approach and so much more accessible than it used to be. So that's very good news, I think. And finally, we have just about a minute left here, and I want to ask about this really ambitious goal that CVS Health has set of reducing suicide attempts by 20% among its members by 2025. I wonder, how do you achieve such an ambitious goal?
Well, first, the most important part is you need to put a stake in the ground and make a bold goal because we believe suicide is preventable. And so when you have that core belief, and as a healthcare company, we have that belief. And so we've put in policy systems and environmental changes that really help us prevent attempt. And so by doing that, in our first year of this goal, we've already achieved great results, but we are even working harder to ensure that we have the support and services for all those we serve.
All right, we have to leave it there. Cara McNulty is the president of behavioral health and mental well-being at CVS Health. Cara, thank you so much for joining Axios.
Thank you for having me, Chris.
And now, your next segment.
Thanks, Chris. I'm Caitlin Owens, a healthcare reporter here at Axios. I'm joining you from the office in Arlington, Virginia. Our final guest today is the president and CEO of Mental Health America, Schroeder Stribling, joining us from Alexandria, Virginia. Thanks for being with us today.
Well, thank you so much for having me.
So mental health is obviously an enormous topic. Let's just start out a little bit with kind of a big picture question. What are some of the most pressing issues today that kind of keep you up at night?
Sure. Well, let me tell you, first of all, a little bit about Mental Health America, so you'll know why these things are keeping us up at night. We are a 113-year-old national advocacy organization with 143 affiliates around the country providing direct services and leading advocacy efforts in their local communities. And at our national office, we're doing public policy, public education, and research in support of that network and the field at large. So at present at Mental Health America, we're guided by our consistent mission to prevent mental illness, promote mental health and well-being, and to champion recovery for all. Right now, directly relevant to Suicide Prevention Month especially, we're focused on the youth mental health crisis and reducing deaths of despair and ensuring equitable access to culturally responsive care for everyone in need. Those are the things that are keeping us up at night.
Right. And just, when we're talking about mental health, so much of this is a question of who is affected and who we're talking about. And while obviously mental illness does not discriminate, different societal conditions are a factor here. So can you talk about some of the social determinants of mental health?
Yes. And first, let me start by emphasizing the point that you made initially, which is really important, that mental health conditions can and do affect anyone, and they affect many of us. 1 in 5 of us will have a mental health condition this year alone. Over the course of our lifetime, 50% of us will experience a mental health condition. Therefore, we take a public mental health approach, really looking upstream and aiming to prevent mental health. We know that, as you say, the factors which affect individual and community and population level mental health are multifactorial, and the social determinants are something that we are really focused on and that have enormous impact. So social determinants of mental health could be anything in one's environment which either puts you at risk for the development of a mental health condition or exacerbates an existing mental health condition. So, for instance, housing instability, food insecurity, access to transportation, access to health care and mental health care itself, and parity in mental health care, which is part of access. All of those are social determinants. And I think this is a moment when the pandemic in particular has really pointed out to all of us the driving importance of these social determinants and our need to align ourselves with our peers, our colleagues, and partners who are focused on these issues to strongly advocate for addressing these as a matter of prevention and also as a matter of getting people the access they need in crisis circumstances.
Right. And as you mentioned earlier, it is Suicide Awareness Month. Kind of a big topic lately is this new federal suicide crisis hotline. Can you talk through about what some of the early successes and early challenges of that hotline have been?
Yes, well, thanks for the question, and I'm really thrilled that you brought it up. And I also know I think you're going to be hearing from Assistant Secretary Delphin Rittman, which is terrific. She can speak at length about it, and we're proud of her leadership in this area. this new number is intended to deliver a mental health specific response instead of a police or criminal justice response to a mental health crisis. So meeting the person at their time of need with the right response and the right responder. The number is now live. As you know, it went live in July. And I just heard actually yesterday some early data from my friend Bob at American Foundation for Suicide Prevention that the call volume to this essentially replaces the suicide hotline. And the call volume has increased, which is a good thing. It means that people are actually using the number. The other good news is that the wait times are shorter than we expected and fairly immediate so far. This is really early information. Some of the remaining challenges here, and we want to be very careful in setting expectations, because just like when 911 was introduced as an emergency response effort, it took years for that to become institutionalized and operational in the way it is now. The same is true for 988. It will take time. And very much of it right at the moment is up to the states and how the states are implementing 988. Many of our affiliates are involved in the rollout of these efforts, and we're very pleased to see that it's going so well so far. The basics of 988 are this idea that when someone's in crisis, you have someone to call, and sometimes a call is all you need, and that might resolve the crisis in the moment, but also someone to come and help you, and the right person to come. So rather than a police officer, maybe a peer or a social worker or other support people. And then if necessary, somewhere to go as a third step. And that's where we need to think about the development of an adequate network of crisis stabilization centers in the various states. So there's a lot more work left to be done. Some states are quite well prepared with that infrastructure. Others are still working on it. So we've got a ways to go, but it's a promising start.
And that's a perfect segue to what I wanted to ask you next. What are some of the most important next steps that policymakers can take to try to address, the mental health crisis writ large? And if you want to get into specific areas of that, feel free to.
Well, I would say that one of the things we really believe in at Mental Health America is focusing on prevention. And even in a crisis moment when it might seem hard to look upstream and focus on prevention, it's really important. This is how a public health approach to prevent illness, promote wellness. So prevention is for everyone. It's not just primary prevention for people who have never experienced a mental health condition, but it's also ongoing supports for people who are in recovery or seeking recovery. That's equally important. So we endorse and we have a specific prevention and early intervention program at Mental Health America, and we believe that these principles of prevention, of providing people with the knowledge and resources they uniquely need to be healthy and resilient, getting them access to routine screening, and which enables early identification. We know that early identification leads to improved outcomes. When our grandmothers told us that a stitch in time saves 9, they were right. The scientists have proven them out. But also fundamental to prevention, and I'll loop this around to your first question because it's really important to us at Mental Health America, is that prevention also includes addressing the social determinants of mental health. So housing and food security, transportation, et cetera, so that we are, to the best of our ability, giving people the vital conditions they need to be mentally healthy and to thrive in their communities.
We only have just over a minute left, which is not fair for the question of this size. Something that we've been talking about a lot is the youth mental health crisis. What are some of the trends we're seeing there? And then what are some of the biggest solutions that you think would make a difference?
Yeah, this is an enormous concern, as you say. I mentioned our screening program, which opened in 2014. We have a dozen free, anonymous, confidential screens that people can use when they have a question or concern about their own mental health. And since we launched, over 14 million people have used it. 15,000 people a day are now coming to screen themselves, and about half of those are youth. This is the nation's largest real-time mental health early identification program. And one of the benefits of it was that we were able to watch in real time what was going on with the population during the pandemic. We had an over 500% increase in the traffic there. Again, mostly youth. Youth ages 11 to 17 were more likely to score positive for anxiety and depression, and youth of color and LGBTQ youth had especially high rates of depression, anxiety, and suicidal ideation. So these are really worrying red alarm bells for us. And we think about the perfect storm of mental health stressors that youth are in, especially now with the return to school, the fears that that might involve, the disruption of the past couple of years, the ongoing impact of social media, adverse childhood experiences, et cetera. So we're very focused on listening to youth, understanding their fears and their needs to effectively support them, equipping them to help themselves and their friends, and equipping schools with the resources that they need to address the trauma and mental distress among students that they're going to see as we emerge from the pandemic.
We are unfortunately out of time. 10 minutes was not long enough for such an enormous topic. But Schroeder, thank you so much for joining us today.
Thank you so much. It was a pleasure.
Thank you all for joining this afternoon for another virtual conversation that made everyone smarter, faster. For more information on America's mental health crisis, or to sign up for the Vitals newsletter, visit axios.com/newsletters or the Axios app. Thank you all for joining, and we'll see you on axios.com.